The hidden truth: is your healthcare secretly stealing your golden years? A silent, often overlooked threat lurks within our healthcare system, capable of stealthily eroding the golden years you've worked so hard for. Many believe that more medical tests mean more protection, especially as we age. But what if this widely held belief is not only mistaken, but profoundly dangerous, costing you not just peace of mind, but potentially years of vibrant, independent living? What if the very procedures designed to extend your life could, in fact, drastically diminish its quality, trapping you in a cycle of anxiety, painful interventions, and complications you never needed? This isn't just about avoiding discomfort. It's about safeguarding your precious longevity and ensuring that every decision made about your health truly serves your best interest, not just a standard protocol that might be decades out of date for someone your age. Dr. Linda Parker, a distinguished urologist and senior health specialist, is here to pull back the curtain on this uncomfortable truth, sharing critical insights that 91% of doctors simply don't discuss with their elderly patients. The stakes couldn't be higher, for understanding this information isn't merely knowledge, it's your shield against unnecessary medical harm, your key to maintaining independence, and your ultimate safeguard for a truly fulfilling life after 70. The unspoken reality of senior healthcare. For far too long, our healthcare system has operated under a misguided premise that a medical test beneficial for a 50-year-old is equally beneficial or even necessary for someone over 70. This one-size-fits-all approach is not just inefficient, it's a profound disservice, often leading to a cascade of unnecessary anxieties, misdiagnoses, and even dangerous overtreatments. While the intention might be good, the reality is that the risks and benefits of medical interventions shift dramatically as we age. What might be a life-saving screening in middle age can become a source of significant harm, complication, and reduced quality of life in our later years. It's time to champion an approach where patient advocacy trumps rigid medical protocols, where informed decision-making replaces blind compliance. We must move beyond the notion that more always equals better in healthcare, especially when it comes to individuals in their 7th decade and beyond. This crucial distinction, often obscured by routine medical practice, is precisely what empowers you to make choices that truly protect your well-being, enhancing both the length and richness of your life. The 5 medical tests you must question. Through 25 years dedicated to geriatric urology, Dr. Parker has witnessed firsthand the profound and often devastating impact of specific medical tests routinely ordered for seniors over 70. These aren't obscure procedures. They are deeply entrenched in standard practice, yet they frequently lead to what she terms overdiagnosis, finding conditions that would never actually cause harm, and overtreatment, subjecting patients to aggressive therapies with serious side effects, all for no real benefit. Indeed, a staggering 91% of doctors, perhaps unintentionally, fail to openly discuss the true balance of risks versus benefits with their elderly patients when recommending these procedures. The consequences are real: debilitating side effects, heightened anxiety, and a diminished quality of life. The time has come to equip yourself with the vital questions that can literally change the trajectory of your health journey, allowing you to sidestep these potential pitfalls and embrace a future defined by genuine wellness, not unnecessary medical complications. Questioning prostate cancer screening, PSA, after 75. First on this critical list is the routine PSA screening for prostate cancer, particularly for men over 75. While invaluable for younger demographics, for many elderly men, this test has become a source of massive, often preventable harm. The harsh reality is that prostate cancer in older men typically progresses at an incredibly slow pace. So slow, in fact, that you are statistically far more likely to pass away with it rather than from it. Yet, an elevated PSA score often triggers a cascade of aggressive and invasive procedures. This can begin with painful biopsies, carrying risks of serious infections, significant bleeding, and acute discomfort. These biopsies frequently lead to a diagnosis of a slow-growing cancer that poses no immediate threat to your life or well-being. The subsequent recommendations for aggressive treatments, such as major surgery or radiation, come with devastating, often permanent side effects like incontinence and erectile dysfunction. Landmark studies, including one published in JAMA involving 76,000 men, unequivocally show that PSA screening in men over 70 offers zero mortality benefit. You're essentially enduring substantial risks and life-altering side effects for a survival advantage that simply doesn't exist. Before agreeing, ask your doctor, given my age and overall health, what is my realistic life expectancy? Am I truly more likely to die with this prostate cancer or from it? What are the specific long-term harms of the biopsy and treatments being suggested? Rethinking routine colonoscopy after 75. Next, we turn our attention to routine colonoscopy, a procedure widely lauded for its efficacy in detecting colon cancer in younger adults. However, for individuals over the age of 75, especially those with a history of normal screenings, the risk-benefit equation shifts dramatically, often tilting decisively towards harm. For elderly patients, a colonoscopy carries significantly elevated risks of severe complications, including bowel perforation, a dangerous hole in the colon, substantial bleeding, and adverse reactions to anesthesia. Studies indicate that the complication rate for patients over 75 can be 3 to 4 times higher than for their younger counterparts. Furthermore, even if polyps are discovered, the subsequent treatments for these findings introduce additional layers of risk. Leading medical bodies, such as the American College of Physicians, now actively advise against routine screening colonoscopies for average-risk adults over 75 who have had previous negative screenings. The likelihood of developing a treatable colon cancer that would realistically impact your lifespan at this age is exceedingly low, while the dangers associated with the procedure itself are considerably heightened. Instead of blindly agreeing, question your doctor. Considering my history of normal colonoscopies, what is my actual specific risk of developing colon cancer that would genuinely affect my lifespan? What are the precise complication risks associated with this procedure at my age? And are there less invasive, equally effective alternatives, such as advanced stool tests, that we should consider first? Scrutinizing mammography screening after 75. The third test to approach with informed caution is routine mammography screening for women after the age of 75. Much like prostate cancer screening in elderly men, breast cancer screening in very elderly women frequently leads down a path of overdiagnosis and overtreatment, uncovering cancers that in all probability would never pose a threat during their remaining years. Research, including findings published in JAMA Internal Medicine, reveals that while mammograms in women over 75 do detect numerous cancers, treating these often slow-growing lesions rarely, if ever, translates into improved survival. What it does lead to, unfortunately, are surgeries, radiation therapy, and chemotherapy regimens that significantly diminish quality of life without extending it. The harm extends beyond the emotional toll of false positives. It encompasses the very real physical damage and profound reduction in well-being from aggressive treatments aimed at non-threatening cancers. These interventions in elderly women carry substantial risks of complications and, ironically, can even shorten life rather than prolong it. Before proceeding, ask your doctor, based on my overall health, what is my realistic life expectancy? If a slow-growing cancer were found, would treating it genuinely extend my life, or would it primarily reduce my quality of life? What does the latest medical evidence specifically suggest for women of my age and health status? Reassessing diabetes, screening and glucose control in frail elderly. Next, we address aggressive diabetes screening and the pursuit of overly tight glucose control targets in frail elderly individuals. While meticulous diabetes management is undeniably crucial at any age, the relentless pursuit of extremely low glucose levels, an HbA1c under 7.0, in frail older patients often proves more detrimental than beneficial. This aggressive approach dramatically increases the risk of dangerous hypoglycemia, dangerously low blood sugar, which can lead to confusion, severe falls, and urgent hospitalizations. Numerous studies have clearly demonstrated that pushing for such tight glucose control in elderly patients actually increases mortality rather than reducing it. The immediate tangible risks of severe hypoglycemia far outweigh any theoretical long-term benefits in individuals with a naturally limited life expectancy. Consequently, the American Diabetes Association now advocates for more relaxed glucose targets for elderly patients, with an HbA1c of 7.5 to 8.5 often being more appropriate and safer. Yet, it's a common occurrence for doctors to aggressively strive for lower targets, inadvertently exposing their patients to perilous complications. Take the initiative and ask your doctor, considering my age, overall health, and potential frailty, what glucose targets are truly appropriate and safest for me Pao Meng specifically? What are the documented risks of hypoglycemia with such tight control, and would a more relaxed, individualized target actually prove to be a much safer and healthier approach? Questioning: routine cancer screening with extensive imaging. Finally, we must critically examine the practice of routine cancer screening through extensive imaging, such as CT scans and PET scans, for elderly patients without specific symptoms. While these advanced imaging techniques are powerful diagnostic tools, their routine application as a just-in-case measure in seniors carries significant and often overlooked dangers. Firstly, these tests expose patients to substantial doses of radiation. More critically, they almost invariably uncover incidental findings, minor abnormalities that are often clinically insignificant and would never, under any circumstance, cause problems or impact remaining lifespan. The profound problem arises when these harmless findings trigger an alarming cascade of further invasive tests, more scans, biopsies, and even unnecessary surgeries and treatments. A study published in JAMA Internal Medicine starkly revealed that incidental findings from imaging in elderly patients led to complications from follow-up procedures in a staggering 23% of cases, with zero improvement in actual survival. These interventions cause real harm, anxiety, and expense, all while providing no genuine benefit. Before consenting to such a scan, empower yourself with these questions. What specific symptom or urgent concern makes this scan genuinely necessary for me right now? What is the realistic likelihood that any finding from this scan would actually change my treatment plan in a beneficial way or truly extend my life? And what are the documented risks of finding incidental abnormalities that could lead to potentially harmful and unnecessary follow-up interventions? The uncomfortable truth, a real-life example. To truly illustrate the devastating impact of these routine yet potentially harmful tests, consider the story of a 78-year-old patient who visited Dr. Parker's office. His primary physician had ordered a routine PSA test despite his age, and a slightly elevated result initiated a chain of events. A biopsy was performed, leading to a severe infection so serious it required hospitalization. The biopsy did indeed reveal a slow-growing prostate cancer, prompting his urologist to recommend immediate aggressive surgery. However, upon Dr. Parker's careful evaluation, it was clear that his realistic life expectancy, based on his overall health, was approximately 8 to 10 years. The type of prostate cancer he had, she calculated, would typically take 15 to 20 years to progress to a point where it might cause problems. Had he undergone the recommended surgery, he faced the near certainty of permanent incontinence and erectile dysfunction for the rest of his remaining life. If he opted for no intervention, he would, with overwhelming probability, live out his years comfortably and pass away from an entirely different cause, long before the cancer ever became an issue. Wisely, he chose active surveillance, a mindful approach of doing nothing but monitoring. 5 years later, at 83, he is living a full, vibrant life, completely free from the debilitating side effects of unnecessary treatment, and his cancer remains unchanged. This isn't an isolated incident. Dr. Parker has witnessed hundreds of similar cases where elderly patients have been subjected to tests and treatments that, in retrospect, should never have been ordered, causing profound harm instead of help. This is why knowing your rights and the evidence is so critical. Empowering yourself with medical evidence and rights. The medical evidence underpinning these concerns is not anecdotal. It is clear, robust, and increasingly supported by leading health organizations worldwide. Here are the undeniable facts that empower you as an informed patient. Firstly, the vast majority of reputable medical organizations now explicitly advise against routine cancer screening for adults over 75, especially those with limited life expectancy, as the harms consistently and significantly outweigh any potential benefits. Secondly, medical testing should never be a blanket protocol. It must be highly individualized, meticulously tailored to a patient's overall health status and realistic life expectancy, not simply their chronological age. A robust and active 75-year-old is a vastly different individual from a frail one, and their medical needs reflect this crucial distinction. Thirdly, the fundamental question we must all ask is not merely, can we find a disease, but rather, will finding and treating this particular disease actually improve my length of life, or, more importantly, my quality of life? For many conditions identified in elderly patients, the honest answer, supported by evidence, is a resounding no. And most crucially, never forget this. As a patient, you possess the absolute right to refuse any medical test. A doctor's recommendation is precisely that. A recommendation, not an obligation. Especially when compelling evidence suggests that a test or procedure may cause more harm than good. Your informed refusal is not just acceptable, but often the wisest decision you can make for your own health and well-being. The 3 critical questions to ask your doctor. Before you agree to any medical test after celebrating your 70th birthday, arm yourself with these 3 indispensable questions. They are your immediate defense against unnecessary medical intervention and your pathway to genuinely informed decision-making. First, you must ask, based on my overall health, what is my realistic life expectancy? Be direct and seek an honest assessment. If that estimation falls below 10 years, the medical evidence strongly suggests that most routine cancer screenings are unlikely to be appropriate or beneficial for you. Second, inquire. If this test uncovers something, what would the proposed treatment involve, and what are its specific risks and potential side effects? Understand the full implications of a positive finding. If the risks associated with the treatment are high, or if the side effects significantly compromise your quality of life, then the test itself may simply not be worth the potential downstream harm. And third, demand. What does the most current medical evidence show about the true benefits versus risks of this specific test for someone by my age and with my particular health status? Do not settle for vague reassurances or standard protocol explanations. Insist on evidence-based answers tailored to you. You have an absolute right to be an informed, empowered patient, making healthcare decisions that align with your priorities and personal goals for a high quality of life, rather than blindly following protocols designed for younger, healthier populations. Beyond tests, nurturing your health. Naturally. Yet, taking control of your medical decisions isn't just about avoiding potential harm, it's also about actively nurturing your health and vitality in ways that genuinely serve you. While it's crucial to question unnecessary medical interventions, it's equally important to embrace natural, supportive approaches that maintain your optimal health and energy without the inherent risks of aggressive treatments. This proactive approach allows you to thrive, keeping you healthy enough to potentially avoid the very need for such interventions in the first place. That's why Dr. Parker frequently recommends two potent natural support options designed to help seniors maintain peak health and vibrant energy for those seeking gentle yet effective support for overall well-being and cardiovascular health while confidently navigating medical decisions. She suggests incorporating organic watermelon extract, a rich source of natural L-citrulline. This powerful compound supports healthy circulation, promotes robust cardiovascular function, and boosts natural energy levels, all without the risks associated with more aggressive medical interventions. However, for individuals who aspire to complete health optimization, not just avoiding harmful tests, but proactively enhancing their energy, sharpening their cognitive function, and sustaining the vitality that helps them sidestep aggressive medical interventions altogether, the Advanced Senior Vitality Formula offers a comprehensive solution. This expertly crafted formula combines several synergistic ingredients: icariin, derived from horny goatweed, known for supporting healthy circulation and boosting energy; tonkat ali, a natural adaptogen that aids in hormone support and overall vitality; fenugreek, which contributes to sustained energy and graceful aging; nettle root, specifically included for its natural benefits to prostate health, offering a gentle alternative to aggressive medical strategies; and a concentrated dose of L-citrulline to ensure optimal cardiovascular function. Together, these ingredients work in harmony to foster robust health and vibrant vitality, empowering you to maintain wellness naturally, significantly reducing the perceived need for aggressive medical testing and potentially harmful interventions. You can find both of these transformative options linked conveniently in the pinned comment and video description below. Your future, your informed choice. The power to shape your health journey after 70 rests firmly in your hands. By embracing knowledge and demanding transparency, you move beyond mere patient status to become a confident advocate for your own well-being. Quality of life in your later years is not about passively complying with every medical protocol. It's about making deeply informed choices that reflect your individual priorities, your unique health profile, and your desire for a life lived with vibrancy and dignity. Don't let fear or outdated assumptions dictate your healthcare. Instead, take courageous control, armed with the understanding that sometimes the most profound act of self-care is knowing when to question, when to refuse, and when to choose a path less traveled by standard medicine, but one that leads directly to a longer, healthier, and more joyful life.